That is why early next week, the COVID Cabinet Committee will approve a plan for the careful lifting of public health measures, beginning with the restriction exemption program. We introduced this proof of vaccination program reluctantly to avoid a catastrophe in our hospitals during the Delta wave in September, when Alberta and Saskatchewan were hit hardest because we had the lowest level of vaccination in Canada. And when the REP was introduced, vaccines were still very effective at limiting transmission and infection. The REP applied to discretionary social activities, which were higher risks of transmission. We did not apply it to essential low-risk work activities like, well, for example, driving a truck. And the REP in Alberta has allowed for a negative test option for those discretionary activities, like going to a nightclub or a casino or an NHL game. Unlike the federal mandates applied to essential work roles, which have not allowed for a rapid test option, and of course Alberta is fighting those mandates. So the REP also led to a major increase in Alberta's vaccination rates, which honestly has saved many lives and helped us to avoid canceling thousands more surgeries during both the Delta and Omicron waves. So the restriction exemption program has done its job. But the reality is that with the Omicron wave, we have seen that the power of vaccines to reduce transmission and infection against this highly transmissible variant has declined significantly. And this is in part because most Albertans got their last vaccine shot, typically their second shot, last summer, and they have not yet received the more recently available booster shots. So let me be clear, though, that vaccines are still tremendously powerful at preventing severe outcomes like hospitalization and death. And the single best thing that you can do to help us open quickly, to stay open, and to keep yourself safe is to get your booster shot. But with much higher levels of vaccination and much lower levels of preventing infection from vaccines months ago, the rationale for the proof of vaccination programs like Alberta's REP is not as strong today as when we introduced it in September. As COVID changes, our response to it must change as well. And that is why early next week, Alberta will announce a firm date to end the REP and to do so in the very near future. We will also lay out a simple, phased plan to remove almost all public health restrictions later this month, as long as we see a trend of declining pressure on our hospitals. Now, I know that some people will say all of this is too early, that we should chase a policy of COVID zero, that it's all too risky. But friends, after 2 years of this, we simply cannot continue to rely on the blunt instrument of damaging restrictions as a primary tool to cope with a disease that will likely be with us for the rest of our lives. We must find a way to get our lives back to normal. Between 1918 and 1920, about 50 million people around the world died from the Spanish flu pandemic. Most of the world, including Alberta, you can look it up in the history books, well, we all put in place public health restrictions very similar to those that we've had in place in our province on and off over the past couple of years. But with growing population immunity and less lethal variants, the Spanish flu eventually became endemic. In fact, viral descendants of the Spanish flu continue to circulate and infect us today. But our ancestors learned to live with it, just as we must and will learn to live with COVID-19. Now, compared to the 1920s, we now have the enormous advantages of much more effective and readily available vaccines, drugs, medical treatments, and knowledge. We have all developed better hygiene habits over the past 2 years, like, for example, staying at home when we're sick. We can and must get on with our lives, restore our freedoms, and live with joy, not fear. So please stay tuned for our careful plan to do just that, which we'll announce early next week.